Really, today our focus was on SHA and registration and making sure that the people of Nakuru have registered for SHA so that when they come to seek services in our facilities, we are able to treat them and they don't have to worry about paying or about money. In addition to that, one of our bigger issues that we have discussed this afternoon was our regional cancer center that's here in Nakuru, which our Waziri Mheshimiwa Duale has been very helpful in as far as helping us get more equipment in that health center or in that cancer center so that we are able to treat more patients with cancer. In fact, the patients that we treat there are from 24 counties. So it's really big. And from what we have discussed this morning, we have seen that from SHA, when the cancer patients have SHIF, the reimbursement amounts are really great or much more than what NHIF used to do. So as we stand here today as Nakuru County and leaders from national government as well as from the Ministry of Health, we are really just excited to make sure that we can onboard as many people in this county as possible, get them in SHA, so that they can get the treatment they deserve or they need with dignity, and so that also the indigents in the county too, we have discussed how as a county we shall be working together with national government to make sure that we take care of our indigents, be they our older parents who are probably not able to make those payments, be they our teenage mothers, be they our street children, just everybody and anybody who is not able to cater for these fees, then we want to be able to make sure that they are able to get into SHA. So anyway, it's been a very productive morning. I was just giving that as an overview, or rather not just morning, but afternoon as well. In here, we have met with our medics, our med soups, all those people who work in the health ecosystem, and we are just wanting to make sure that as a county, as Nakuru County, we are doing well in Taifa Care. And I also wanted to say, sometimes it's also good to appreciate that as a county, our PGH, as we usually call it, but the Nakuru County Referral and Teaching Hospital, is actually #1 in the country in as far as the claims that and the payments made by SHA. In addition to that, we are making sure that we have trained all the other facilities so that they are able to register you. We have a desk as a person from Nakuru County. When you walk into any of our facilities, we have a desk that will help you register into SHA so that we can make sure that we get away from those days where we had to keep fundraising for health services. And as a county, we also, the biggest budget in our county, which is almost actually 30-something%, goes to health. And with what we are also getting from the national government, then we are able to make sure that what the President of the Republic of Kenya, His Excellency, Dr. William Ruto, promised the people of Nakuru and indeed the people of Kenya as far as health, Taifa Care, that we are able to make it a reality.
In Nakuru, we have got 409 healthcare providers who are contracted with SHA. We only have 6 public facilities, but those we have found out are not really under the county. Maybe health centers in Egerton University, health centers in our prisons or in our security agents. As of today, we have paid 43.9 billion from SHIF and 5.6 billion from PHC fund. And let me make it very clear, and I have told the governor and the leadership here, the primary health care fund is free. Kenyans should walk to any facility, be it public, private, faith-based, in level 2 to level 4. You walk in, you walk out, you are treated. The government of Kenya, under the leadership of President William Ruto, pays for it. In fact, we have just told the governor to put posters in all those facilities saying, enter and exit, you should not pay. And we are telling Kenya, the parliamentarians are here. They have budgeted 13 billion for that fund. capitation. So if any Kenyan is charged for primary health care, that is an offense, is a criminal offense, and Kenyans must report through our call center 147. But as of today, 5.6 billion has been paid from that fund. SHA is transforming our health facilities, and in Nakuru County alone, 1.27 billion in SHA claims have been disbursed. And I have, as the governor has said, the Nakuru PGH, our referral hospital, in terms of lodging claims, in terms of payment and system, is the best in the country. And we have seen that the healthcare system in Nakuru is up and running. It is something that many other people should borrow from. Let me come to the National Equipment Support Program, because we want to make sure, this government wants to make sure, for universal health care to succeed, we must have drugs in every facility. For universal health care, Taifa Care to succeed, we must have the right equipment in our health facilities. And in this program of the National Equipment Support Program, which is transforming access to care. And this equipment, let me make it very clear, it is not bought by the national government, it's not bought by the county government, it is bought by the suppliers, it is fee for service. They are the ones who will take care of those facilities, those equipment. The number of Kenyans who use that facility, SHA will reimburse those equipment owners. So there's no investment. And Governor, I am very happy to report that Nakuru County will in the next 2 weeks realize the impact of the National Equipment Support Program. The following equipment will be installed in the month of from the first week of August. In Annex Hospital, we are going to install a mammogram, dialysis machines, and orthopedic machines. In Bondeni Sub-County Hospital, a specialized laboratory service equipment will be installed. In Molo Sub-County Hospital, digital X-ray, CT scan, routine laboratory service equipment, and all others that are required, that have requested, will be installed. The same for Bahati, CT scan, and general theater services. For Karinget, they have all that, digital X-ray, Langalanga Sub-County, Subukia Sub-County, Orongroni Sub-County, Njoro Sub-County, Maimayu Level 3. All these sub-county hospitals will receive the latest equipment. This intervention will bridge the critical gap and expand equitable. As we move forward, let us recognize that health is not just about systems. It's about trust, it's about dignity, and it's about community. And that's why the dignity of the patient is of paramount importance. Going forward, the patient is the boss, not the facility, not the healthcare worker, not the leadership. And that's why we have introduced, and this is very clear, we have introduced in the last 3 weeks something called bed capacity access code. No Kenyan, no health facility, be it public, private, faith-based, will be allowed to operate outside their bed capacity given to them by the regulator, who is here, Dr. Kariuki. When you apply for a license, you must say how many beds do you need. If you said 50, you will admit 50 patients. No more Kenyans sleeping on the floor. No more Kenyans sharing beds. Kenyans who don't know each other, they have different ailments. And if you tell us, oh, they are Kenyans, we can't return them, from Nairobi, from my office, the office of the PS, from our people here, the digital CEO, the SHA CEO, we will call the governor and we have told her this morning, this is how the bed capacities are. All your hospitals have enough beds, empty. For us, it's a very historic milestone. It's part of what we are doing around counties called the activation of Taifa Care and the Digital Health Transformation Agenda, which are very, very important pillars in achieving universal health care coverage. Through Taifa Care, we want to ensure that every Kenyan can access health care without financial hardship. The integration of the Social Health Insurance Fund, the Primary Health Care Fund, and the Emergency Chronic and Critical Fund is reshaping the health financing landscape in our country because it is inclusive and because it is responsive. The Social Health Authority, which is very central to this transformation, has of today registered 24.7 million Kenyans. They have already enrolled that number. And out of these, over 6 million Kenyans have underwent through the mean testing with an average contribution of 590. That is why the governor is paying close to 40,000 for her Social Health Authority Insurance Fund. That's why I'm paying over 35,000. And that is why Mama Mboga, when she goes through the mean testing, average is 590. So our commitment to make sure that healthcare is accessible, is equitable, and is affordable has come to pass. And this is a very clear sign of public trust in the system. Nakuru County, as of today, has registered 840,386, constituting 39% of the population. So we still have huge numbers to cover in Nakuru County. We have only covered, those who have registered are only 39%. And only a fraction of the registered households have paid their premiums. A lot of people have asked us, how do the informal sector, the salaried people, their contribution is paid by the employer? How do Mama Mboga, how do the people in the informal sector, how do they pay the annual premium if they don't have the money? We have said it, Lipa SHA Pole Pole initiative has brought affordability and flexibility. And I want to tell the people of Kenya, every day between 8,000 to 10,000 Kenyans in the informal sector pay their annual premium. The Lipa SHA Pole Pole is a very progressive because it tells you if you are to pay, for example, and this I need to make it clear, if after you go through the mean testing and you are told your annual monthly premium is 300, you multiply by 12, it comes to 3,600. Then you pay 4 months in advance. Then the balance you are told, do you want to pay weekly, monthly, or daily? And last night you could see in our system, there are Kenyans who went through that system, and daily they are paying 10 shillings, 15 shillings. And at the end of the day, the system will tell you pay. If you don't pay that day, the next day you'll pay double, 20 shillings.
But I will explain to you the current benefit package that we have for cancer care. So under cancer care, Kenyans are eligible to 550,000 Kenya shillings. That's a little bit over 500,000 Kenya shillings. And this package covers for all types of cancer. Now, the journey of a cancer patient is particular in a manner where step one is to plan out the management of this patient. And step one involves diagnosis. We need to find out what kind of cancer do you have and what stage of cancer do you have. And to do that, SHA actually has and reimburses the tests required, the biopsies required to determine the diagnosis of the patient. Once we have the diagnosis of the patient, we then define the management plan. And the management plan can be surgical or medical, or both. If it is a surgical plan, then surgery is actually catered for on SHA rates that are available in the tariff, depending on what part of the body would be excised, where the tumor would be taken out. Now, if this patient is determined to require both medical and surgical care will be covered by SHA, and we have those examples of patients who've received surgical care. Two, medical care will now involve chemotherapy cycles at that cap limit of 550K. And so erroneously so, the patient who came to your offices still has a balance in his cover, and he has not exhausted his cover. And we're willing to help him. He just needs to dial 147, and we'll attend to his case and educate him on the cover and the availability of his cover. Now, once that is complete and a patient has exhausted all the cycles that they require, they then are upgraded to the ECCI fund, where we have an additional cover of 150K Kenya shillings. And so the cancer package under SHA is actually better and more comprehensive compared to that was in NHIF.